Hello, hello. Welcome to the Global Citizen Therapy Podcast, the podcast for women of color who are daughters of immigrants to feel seen, heard, and validated. My name is Nancy Diaz, and I am a trauma-informed therapist, speaker, and your podcast host today. And now, let's jump into today's episode. Hi, welcome back to the Global Citizen Therapy Podcast. I am so excited because we're starting season 4. And season 4 is going to be all about sex, sexuality, sexual health. And if you're surprised by this and you think, why is she talking about these things? Well, it's because they've been taboo subjects for so long in communities of color. And so we're going to destigmatize all of it. We're going to talk about exactly how all these topics tie back to our mental health, because they do. So we're definitely going to cover quite a lot. And so you're definitely going to want to tune in. And now I would love to introduce our very special guest today. And yes, I'm so excited. I'm so excited that I found you because I found you on Instagram and it was so random. But yes, as soon as I saw the content that you were putting out, I was like, I would love to have you on the podcast. So please, everyone, help me welcome Ivanna. She is an amazing sexologist, doctora Latina, and she is going to, have a great conversation with us today about all things related to sexual scripts. We're going to be talking about gender roles in the bedroom. We're going to be talking about LGBTQ plus issues and whatever else we come up with. I have so many questions. I have so many things that I want to talk to you about, Ivanna. So yes, first, before we get started, welcome. Did you want to go ahead and introduce yourself? Please tell us a little bit more about you.
Yeah, thanks for having me. I'm Dr. Ivanna Maupome. I was born and raised in Mexico City, lived there for most of my life, got my medical degree back there, and then decided to pursue a master's degree in sexology here in Australia. And that's why I moved to Australia and now currently living in Australia. And I started putting out some information on Instagram where you met me, just because there's a lot of misinformation out there, a lot of stigma as well. So I'm trying to break down the taboo around sexuality for people to feel more empowered and open about what they feel and what they think about sexuality as well.
Amazing. Yeah, thank you so much. And how funny that we ended up finding each other. We're both in Australia. We're both from North America. You're a first generation migrant, second generation migrant, but also now a first generation migrant to Australia. So we already have so much in common, so much to talk about. So yeah, let's dive right in. So tell me a little bit about, of course, I think the question that's been on my mind is, what made you decide to become a sexologist and to study sexology?
Yeah, so while I was doing my medical degree, there was so little information about sexuality. So we know some anatomy and how gender that is as well, like based on sex. And then I went to do some work in an HIV clinic back in Mexico at a big hospital. And that's when I first kind of got my curiosity about sexual health, first as sexual infections, but then more about the impact it had on their sexual lives. And yet we know a lot of, diabetes, hypertension, obesity have an impact on sexual health. However, doctors don't ask on their appointments to patients, and patients are not asking doctors. So it was kind of like, you're suffering on the sexual side, but you're not asking or bringing that up in your appointment. So it was kind of, we need to change that. And that's because a lot of people are afraid of what would the other person would say, given the doctor, or if I'm the doctor, what would my patient say if I am asking about their sexual life? So that's what got me into pursuing a career in sexual health.
I love that. Yeah, and I think we do have to be very mindful as health professionals, whether mental health or physical health, of that power dynamic that we have, right? And that our clients see us as experts, and they see us as these professionals, and sometimes we're up here and they might still, even if we've been working with them for a while, they might still feel uncomfortable in bringing certain things up. And there's so much shame, and there's just so much to unwrap with sexual health, with sexuality, that, yeah, I think that's amazing. And I think for me, it's been a bit of a similar journey as well, that I started to kind of notice, wow, there's so much that sexual health has to do with our mental health. And of course, mental health impacts our physical health, and it's all just one, right? So yeah, that's kind of why we're here, why we're talking about these things. So yes, tell us a little bit more, because I just started hearing about sexology, I think a few years ago. So I don't know, and I think you mentioned this in our chat before we started recording, but it's something that isn't talked about so much. People aren't very open in Mexico. It's definitely changed over the years, right? But tell us a bit more about how you came across sexology, what it is, and what you like and dislike about
Yeah.
it. There's quite a
Um,
few.
the first time I encountered with something related to sexology was during my medical training. I had clinical sexology, and my professor got my attention as well. Like, I've never heard the term clinical sexology, so what's all about that? And yeah, I think, like you mentioned, something really important. Mental health is closely related to our physical and sexual health, and sexual health will impact, whether we like it or not, our mental health, and then our physical health as well. So I was really intrigued by that. And there's a lot as well of like kind of myths of what a sexologist would do on your appointment. So a lot of people hear the word sexologist and they would be like, someone will have sex with me during my appointment. And we do not have sex with our client. It's more of everything out there about sex you bring into the appointment. We talk about how you feel with your sexuality. Why are you not getting pleasure? Why are you not able to orgasm or have an erection? And how this impacts as well in a holistic way to your mental health. Because a lot of the patients come to me because they're having erectile dysfunction. And throughout the sessions, we discovered that it's more associated with a generalized anxiety that's creating the erectile dysfunction. So being able to see the patient as a whole and trying to not only take away the erectile dysfunction, but rather cut the whole root of what's causing that erectile dysfunction is just amazing as well, to be able to break the taboo for them, but also discover that there's a lot more than just a dysfunction or a difficulty they're confronting. So there's usually more than just not having an orgasm. It's more of, I'm having depression, or I'm having or taking antidepressants, and that's the reason you might not be having the pleasure you're trying to get.
Yeah. And I think it's so important that you touched on this, because there's shame for men, for women, for non-binary folks. There's shame across the board when it comes to sex. But I think the one that we hear about quite often is about men. And in regards to erectile dysfunction, especially, right? There's so much shame in actually admitting that there's a problem, and in getting help. And it's the same thing when it comes to men and talking about their mental health, talking about, the fact that they may be struggling with depression, with anxiety. What we know is that, yes, men also struggle with this, not just women. So let's talk a bit more about that, especially since June is Men's Mental Health Month. What do you think has helped you the most in getting your male clients to open up a bit more about their mental health? What have you noticed, some patterns that you've seen?
So usually they have something that's called performance anxiety. So they develop anxiety over their performance, sexual performance. So they usually have anxiety not only in the sexual part of their life, but they usually want to have control in every part of their life, and therefore have sometimes some traits related to anxiety. When they come to me, they usually are just desperate enough for them to talk about, I have this problem, I just need help. So it gets a little bit easier for them to talk about. They kind of like just want to get it over with. So they're kind of like, I'll tell you everything. But yeah, men usually it doesn't matter what sexual orientation they have, they solely rely on their erections and their penis to be the reason of them being masculine enough. So once they accept that there's much more about manhood and men, that's not penis and erections and ejaculation or orgasms, they kind of relax a little bit and see sexual activity differently, because they need to encourage themselves to have sexual activity that doesn't require solely an erection or getting an ejaculation, and trying to change that mindset of my sexuality relies on me having an erection, or I'm gonna evaluate my sexual activity depending on my ejaculation or orgasm. Then their mindset changes, and they're able to explore more of their sexuality and being able to enjoy more of what they're doing that's not having an erection.
And I think that's so important. And I think you touched on something that I just wanted to highlight, but it's actually redefining the way that they see masculinity, right? And
True.
so for women who are in heterosexual relationships and they are trying to support their male partners with redefining their masculinity, especially if there are problems in the bedroom or if they are struggling with things related to mental health, like depression, what is a way that you think those partners can support them so that they feel more comfortable in opening up either to their partner, to a health professional? Is there anything that you can recommend?
So talking specifically about erectile dysfunction, we usually recommend that the partner comes. If they have like a long, stable partner, we do recommend that they come along, because especially for the partner, it's also impacting on their self-esteem, because we also tend to believe that an erection represents how much I'm stimulating the other person, or am I hot enough for the other person? So if I'm not good enough or I'm not pretty enough, then that's why they're not having an erection. So it also impacts the counterpart, the partner or partners of this person. So we usually invite them to come in for them to improve their communication and explore other sexual activity, because we tend to believe that sex is only penis, vagina, erection, orgasm, and that's it. And then we encourage them to explore other sexual activity that could bring pleasure as well, but in a different format.
Yeah, and I think that's so important, that non-penetrative sex can actually be pleasurable for both partners. Yeah, I think that's important. And to start thinking outside of the box. And I know that we talked about, these sexual scripts. So, and I think we're kind of leading into that. So do you want to explain just what sexual scripts are and how it kind of ties back to what you were saying?
Yeah, so we've been talking about sexual scripts without explicitly saying these are sexual scripts, but sexual scripts are these internalized norms that lead us or guide us on our sexuality, on how to think about our sexuality, when or what do we need to do regards on our sexuality, how to act, think, feel. So, for example, just thinking that the only kind of sex or valuable sex is penetrative sex, like penis, vagina, or thinking that in our Latin communities, I can imagine that most of us women have heard our grandmas and moms and aunties telling us that men will reach any sexual thing, that it depends on us women, that we say here or there, or to stop them. It's hard to translate it to English, but yeah. El hombre llega hasta donde la mujer quiere. So
yes, that it's
men
up
will
to us to stop them.
Exactly.
Yeah.
It's up to
And
us.
they'll
Like
only go as far as we let them go.
Exactly.
Yeah.
So we hear that a lot. We also heard that our first time should be painful. So just expecting it to be painful will make it painful. Sex should only happen when we are in a committed relationship, or even further, only when we're married. And yeah, we don't actually talk about pleasure in our sex ed. And these scripts usually lead us, especially women, to navigate our sexuality with a lot of guilt and shame, because if we're supposed to be the ones to wait until marriage, because I mean, men usually are celebrated when they lose their virginity, and we need to wait and we need to be pure. And so if we kind of let a man get as far as we want, then we are to blame. We're shameful. Our sexuality is usually just surrounded about shame, guilt. We also need to explore more about our pleasure rather than the male part, because sex is over when men ejaculate. So what about us? And these sexual scripts are almost globalized, but very specific as well to every culture and every religion. And we are heavily influenced by Catholic religion, even if we follow or we don't follow Catholic religion. Latin culture is 70% of our people identify with Catholicism. So even if we like it or not, those scripts are influenced by Catholic church as well, like waiting till marriage. And then we also see sex as a biological part of having children. So where's the pleasure in that? So we're only allowed to have sex to reproduce. That's it. So we also leave out pleasure, especially for women. Pleasure is not in our scripts.
Yeah. And I think one sexual script that I just wanted to highlight, that I don't know if you mentioned because there's so many or if you didn't, but it's just that need to always please the man, right? And it's not even in the bedroom, but it's just, giving them what they want, even outside of the bedroom. And so, yes, if they want to take your virginity, which I will also put in air quotes, and I'll kind of explain why we're doing that. It's because for those who don't know, virginity is a social construct. So that's why it's in air quotes. And we'll have a whole other episode about that because I love talking about that. But yes, that definitely is something that, comes up quite often with my clients. So with daughters of immigrants, there is that people pleasing, but there's also wanting to, do something a little bit different, right? For second generation migrants, especially, I think there's that conflict in values, right? Especially like what you mentioned, our mothers and grandmothers have seen and learned about sex in a very different way than what we're learning about in these Western countries, right? And you talked about this too, that culture shock when you came to Australia and you saw like, whoa, people are very open about sex and their sexuality. And I think, yeah, I remember that was the same for me actually the first time that I went to, I think it was San Diego, because yeah, it's just the next state over. But I was like, oh my God, there's a poster of two men kissing on this popular strip, and I was like, oh my God, what is this? This does not happen in Phoenix, and yeah, and I can imagine the shock for you to come over here where, yeah, I mean, here, there was World Pride in Sydney not that long ago, and there's just rainbows and pictures of men kissing everywhere. But yeah, I think it's important to kind of talk about even the sexual scripts for the LGBTQ plus community as well, right? Because we talked about that before we hit record, that there's also those scripts, right? Do you want to touch a bit on that?
Yeah, so sexual scripts are not like only for heterosexual people, although since they're really based on strict gender roles and they're very heteronormative, they usually affect more heterosexual couples. But that doesn't mean that they don't affect any other sexual orientation or any gender as well. Because, for example, if you're a gay man, you're also kind of perceiving yourself as relying on your penis to talk about your sexuality. So if you're having difficulties reaching orgasm or erections, then you also feel that shame of not being able to be this masculine gay man. Or, for example, also gay communities, they tend to consider themselves really open, and a lot of them, when they don't feel these criteria that we also kind of like feel for themselves, like we put in these, like, to be a woman we need to do this and this, and then if I want to be a gay man, then I need to be really open, have sex with everyone, kiss everyone on the club, I don't know, go out with leather jackets or whatever. And this is only our like our construct in here of what a gay man needs to be, sexually speaking, what a lesbian woman needs to be as well, sexually speaking. And then social media nowadays kind of reinforces that stereotypes. We see them on TV, on Instagram, on TikTok, and they only reinforce that idea. And so if I'm a lesbian woman, or I'm a queer woman, or I'm a bi woman, and I'm not following all these criteria about my sexuality that I'm seeing everywhere, then I might not be a full
like you're not enough.
bisexual woman, or I'm not a full lesbian woman, or what am I then? And so it impacts your sexual health because you're not meeting those criteria that, I mean, they're imaginary criteria. There's not a book that says to be a lesbian woman, you need to fill these criteria, but we try to fulfill them for us to be fill these sexual scripts, because we try to use them to guide us to know how to feel or what to think or how to act in regards to our sexuality. So they usually come in feeling kind of lost because they're not feeling that criteria. And yeah, we're really used to, even in porn, we kind of know what the man needs to do and they're all ready for that. And then the woman is ready for this and they don't even need foreplay. So I'm not doing that. I'm seeing that on Instagram. They don't recommend that. So something's wrong with me. The feeling's always something's wrong with me because I'm not filling that criteria that I put myself on.
And that's exactly where the tie is to mental health. We're just going to keep tying it back and helping you connect the dots. It definitely does. Yeah, all of this, trying to fulfill those sexual scripts, right? And trying to make sure that you fit all that criteria and perform the way that you see people perform in porn and all of these things, right? And there's shame around all of these things, related to desire, how much desire you have, all of these things. So it's all related and it definitely impacts our self-esteem. And that's something that I think every single client that I've ever seen has struggled with, is that low self-esteem. And I think definitely for daughters of immigrants, there is something that, yeah, we struggle with that low self-esteem. There's that conflict of values, right? And so we're trying to navigate that, right? Our parents might have wanted us to wait or be in a committed relationship, or they might have, told us or maybe modeled for us that women should always, do what the man wants, right? He wants to go to dinner right now. Let's go to dinner right now. Okay. He wants to have sex right now. Okay. Well, this is what he wants, right? Or it should be painful. Okay. Well, I guess it's going to be painful. And so, yeah, I think talking about these things is super important because it is, about the pleasure that we can find from sex. And once we start finding that pleasure, there are studies that show that once you start having more orgasms, that definitely can improve your mental health. So it's all connected. And sometimes I do think that when we're doing all this work on ourselves, right, personal development, but we're working on improving our health as well, specifically, right? We're going to the doctor and we're working on, fixing whatever issue, trying to ease whatever symptom we're presenting with. Okay, great. Okay, same thing. You go to a therapist. Okay, I'm struggling with depression. Okay, now we've gotten past that. Okay, my self-esteem is a bit higher. I can show up confidently in the workplace. I can set boundaries with my immigrant mother. Great. Let's celebrate that. But how is that showing up for you in the bedroom? And if we're not talking about that, and you're still not showing up confidently there, it's still going to continue to impact your self-esteem and therefore impact your mental health and your health as a whole, right? So we have to look at it from a holistic lens, right? That holistic approach of you're an entire person. So we can't just look at what's going on in your mind. We can't just look at what's happening in your body with your reproductive health. We have to really look at how is this all connected. And that's why I think it's amazing that you're a doctor and that you chose to study sexology, because that's the thing, right? And I've had this conversation, with other women of color, from different cultural backgrounds. And there is always kind of that theme of, oh, well, we go to the doctor, but what's the point? We can't really talk about our mental health, because yeah, they often don't know about mental health. They often don't know that much about sexual health, about even ways to have safe sex, right? I've actually, just as an experiment, the last few times that I've gone to a GP, because I've been moving around quite a bit, so I've seen different GP each time. And I've asked, like, I'm curious about this type of contraceptive or whatever. And no, they always just push you toward that one that they know, right? They don't really have an interest in learning most of the times, unfortunately. So that's why I think, the fact that you exist and that you're talking very openly, confidently on social media, on this podcast about the importance of all these things is gonna just be amazing and help so many people. So just wanted to, first of all, thank you for doing what you do. I think it's amazing.
You mentioned something really important, that's communication, right? And one complaint I've heard a lot is when they ask for contraceptives, or further yet, like STIs test, like sexually transmitted infection test. Why? Like, why do you need that? Like, why do you care? Like, I'm asking that, I'm sexually active, I need one. That doesn't mean that whatever you think that means, I just need STI test. So there's a lot of shame, even within the medical field. That's really shameful for us doctors, that we still think like they're asking me a STI test. Maybe it's because they're gay, or they have multiple sexual partners, or it doesn't matter the reason. It's just safety procedure, like, let's do it. But if we don't feel confident enough, or are afraid of asking to our GPs, I can imagine that you're also afraid of asking your partner sexually something else. And so the base of every relationship, GPs, partners, families, communication. So we really need to, what I always encourage my patients is just work on your communication with yourself first, because that's who you talk the most with, and then to the other person. It could be your GP, or your parent, or your dog, whatever it is, because it is a good solid base for you to work from there. If you don't want to have sex, you'll need to communicate that. If you want to try new things in the bed, you'll need to communicate that, and you need to have the words and the confidence for that. So that's like the key for any good sex, communication.
Yes, 100%. Yeah. And it is, I think, a little bit like the chicken and the egg, which came first, because I think the more that we continue to work on our communication and improving that, like you said, I love that you said with yourself first, because yes, we have thousands and thousands of thoughts per day going through our head. And so if most of those are negative, which most of those are, then yes, that definitely impacts our self-esteem and can lead to depression and anxiety and all these things, right? So yes, first let's improve the communication with ourselves. But yeah, it definitely, once you start learning to communicate in a nicer way with yourself and communicating in a better way with others, that helps your self-esteem, right? And same thing, yeah, your self-esteem is improved when you know how to communicate better, right? When you can say, like, these are my boundaries, I don't want to have sex right now, or I want to try this, or I want to actually experience pleasure, in the bedroom. So what can you do, and how can we talk about this, and how can we work together to make that happen, right? And walking away when someone isn't interested, because I think that was a big thing for me. And that's why, I was very proud of myself the first time that I actually said, okay, you have no interest in my pleasure, you can go. The door is right there. Because so many times there are those sexual scripts that people are not willing to unlearn, right? And so sometimes men, what I've noticed is that, yeah, they really have no interest whatsoever in anything other than their own pleasure. And so knowing when to say, okay, well, you can take a hike, I think that's empowering, right?
Yeah.
Because we're empowering our clients, so that they can show up confidently in the workplace with their family members, with their friends, setting boundaries left and right. That's my bread and my butter, right? Helping daughters and immigrants set boundaries and make sure that they're putting their first of all, identifying what their needs are, and then putting their needs first, taking care of themselves, because I think definitely across the board, across cultures, but women of color have always put everyone else's needs before theirs. And so this is why, I shout so much about self-care. And this is why you might not think that sex is related to mental health. It definitely is. And self-care is related to sexual health, because that's exactly it. And I love that one of my clients, actually, when I asked her, like, what have you been doing for yourself this month? When you look at how many things you're doing for other people, where in your life are you putting yourself first? And I was so proud of her that she actually thought like, in the bedroom, I'm actually like saying like, I don't want to have sex, and when someone's, in a committed relationship and a long-term relationship or they're married, like there's that expectation of, like you should have or want to have sex, you should, keep your husband happy, all these things. Then it's huge. It's radical to actually say like, no, I'm putting myself and my needs first. And I've identified that I don't need sex this often. I don't have that high desire. So I'm going to say no. And I think that that's amazing. And it's just doing things like that. And I think that's why it's really great to have these conversations, to be really open about this.
And I think you said something really important, that's our needs. And I think that's the big question. A lot of people don't know what they want or what they need. And so that's like the first homework I always give, like, what do you want? What do you need? Like, you need to meet your needs and know your needs, for you to set boundaries or ask for more. I don't know, I want to try this or want to bring this. But how are you going to know that if you don't know what your needs or desires are? So I do encourage them just to sit, put themselves first and see what they want, what they need, and then translate that to their partner or to their partners if they have multiple. So it's really important to sit down and really think about not only your sexual needs, all your needs, but when talking about sexuality, your sexual needs as well.
Good. And I love that you talked about, the multiple partners thing as well, because yes, we've mostly been talking about,
We're allowed
a relationship, but yes, we are allowed to have multiple partners. And, there is, still that conflict and that shame that we feel when we have multiple partners, because even if we didn't grow up in a religious household, I personally did. So there's that kind of spiritual trauma. But in general, right? Society tells women that we should not have multiple partners. And even going back to the whole GP conversation, that's the question that I hate getting the most, right? Like, oh, but how many partners? Like, why do you need the STI check? And it's just, I was like, is that necessary?
And then for women, it only counts if your partners are men. So if you are like, because it has happened to me in the past, and I've asked in classes, like, what if we have a partner that's a woman? Like, oh, that doesn't count like for your sexually active partners. And that's also sexual script, because we are basing that only sex is penis vagina, not anything else. And it kind of discriminates every other type of sex we're having. Even if we are in a heterosexual relationship, every other sex we're having, it's like, do you enjoy that? Okay, great, but that's not sex. Also feels kind of like a burden to people. If they're enjoying more oral sex rather than penetrative sex, they feel like they're not doing something right, because they should enjoy more penetrative sex. And it's just, yeah, we're just discouraged every step, with the GP, with our friends, with religion, on Instagram, on the TV. So sexual scripts are just reinforced every day at every step.
Yes, definitely. And I think that the fact that we're having this conversation and saying like, okay, we're going to work on actually dismantling the system and making sure that we, identify our needs and put our pleasure first. That's definitely going to help, hopefully, more people that are listening to this podcast episode think about, what are my needs? How do I explore those needs? How do I, redefine how I see sex? And like you said, even if you're having sex with with someone and it's not socially acceptable, right? And so there's the sexual script that we have to unlearn. Then how can we actually heal, from that trauma, especially if there is, religious or spiritual trauma? How can we heal from that so that we can start to actually enjoy, because it is going to have a big impact on our mental health. So bringing it back to that, yes, I think that we can't really achieve that, not that healing is a lifelong journey, right? But when we think like, oh, you know what? I think I'm good. Like I'm active, I'm healthy, like everything is good, but you're still not feeling confident, comfortable in the bedroom. And also have to look at that, because I think, like you said, so often we're told by GPs, by friends, by family, by the church, by everyone, that it doesn't matter. Your needs don't matter. You should put them on the back burner and make sure that your partner is the one getting pleasure.
Yeah, true. And we're sexual beings, so at the end we need to make peace with that as well. And whatever our sexual scripts, just try to make them more positive as well, because we don't want to have them as a burden, more of a guide for us to find that pleasure, like redefine them for them to be not a burden, but something that we are proud of and that we can enjoy more our sexual life.
Yeah, definitely. Okay, well, amazing. This has been such a great conversation, and I know that we could keep talking for hours, probably for days about this, but we'll wrap it up for now. But tell us, where is it that people can find you, can connect with you, can work with you? Because I know that people are going to be lining up to learn more about you, to see. I know you're putting out some great content on Instagram, so yes, please tell us where you want to direct people and where we can find you.
Yeah, so you can go to my Instagram, doctora.lectora. That's like the reading doctor. I also have my website, Ivanna Maupome. That's a complicated name.com. And you can also find me in LinkedIn, Ivanna Maupome as well, my complete name. And that's it for now. I only have Instagram, LinkedIn, and my own website. You can find me there.
That's plenty. Awesome. And I will put the links to everything in the show notes and in the description of this podcast so that you can easily find her. So yes, thank you. Thank you so much again for being here, for having this conversation. I think that it's going to help a lot of people. So we're going to do our best to continue to have conversations like this throughout season 4 of the podcast. Like I said, it's going to be all about sex, sexuality, sexual health. Yeah, we're just going to talk about all things related to sex and how we can hopefully make sure that we're not leaving that outside of the conversation when we're talking about health, physical or mental. So yes, thank you again. And I hope you tune in next time.
Thanks.
Thank you so much for listening, and I hope you enjoyed today's episode. As always, I am here to be open, honest, and vulnerable with you because you are not alone. If you want to support this podcast, please make sure to leave a review so others can find it as well. If you're interested in working with me, you can find me at www.globalcitizentherapy.com. And if you'd like to heal your relationship with self-care and learn more about how to find the type of soul care that works for you, you can find the link to my workshop in the description of this podcast episode. Thank you again, and see you next time.